Good afternoon. Early yesterday morning, I received a positive rapid test for COVID-19, which was confirmed last night with a positive PCR test. So I'm quarantining and doing a little work from home this week. I appreciate all the well wishes, and I want you to know that I'm doing fine and currently only experiencing some cold-like symptoms. I attribute that to the fact that I have been fully vaccinated and that I got a booster shot as soon as I was eligible. And I can't stress this enough. Getting vaccinated and getting your booster is your strongest possible defense against this virus and its variants. My focus continues to be on Maryland's strong response to the virus. As I've been warning for the past few weeks, we're entering another pivotal moment in the fight against COVID-19. We are experiencing a post-Thanksgiving surge in our hospitals, which is primarily related to the Delta variant. However, the Omicron variant, which appears to be many times more transmissible than Delta, is rapidly becoming the dominant variant here in Maryland and across the country. There are still plenty of unknowns about Omicron and its severity, but so far, relatively few of the cases of Omicron detected here in Maryland have led to any hospitalizations. But all of our key health metrics are up right now across the board. Our COVID-19 positivity rate is now 11.6%. And while that is much lower than some of our neighbors in the region who are experiencing positivity rates of anywhere from 38 to 43%, it's still higher than we want it to be. Last week, we experienced 3 days of more than 3,000 cases. And today, we're reporting a single day high of 6,218 new cases. Most concerning, hospitalizations are now up to 1,392, which is an increase of more than 180% in the last month. Our projections now show that we could reach levels of COVID hospitalizations in Maryland, possibly over 2,000. And while we do expect that to peak in mid to late January, that is typically around when we also have the peak of the flu season, causing additional strain on our healthcare system. We have already taken a number of steps to actively prepare for this scenario. The Maryland Department of Health and other key state agencies have been working on a daily basis with Maryland's hospitals and the Maryland Hospital Association on critical operational issues. We established a surge operations center to manage bed capacity and fully utilize the alternate care sites that we have kept in place. Health officials also issued a new directive ordering hospitals to undertake actions upon reaching certain thresholds. When we reached 1,200 COVID hospitalizations, Maryland hospitals began to make all staffed bed capacity available and to reduce the scheduling of certain non-urgent medical procedures. If and when we surpass 1,500 COVID hospitalizations, hospitals will immediately implement their pandemic plans. State health officials are continuing to work closely with Maryland's Board of Physicians, Board of Pharmacy, and Board of Nursing to advance emergency regulations to enhance healthcare staffing at hospitals. We are introducing emergency legislation to give our hospital systems additional tools to help address staffing shortages. State health officials are now requiring that all nursing homes offer COVID-19 therapeutic treatments to residents during an outbreak. To further bolster our statewide response, today I am announcing an additional $100 million in emergency funding to address urgent staffing needs at Maryland hospitals and nursing homes. We are committing $50 million through the Maryland Health Services Cost Review Commission to immediately stabilize hospital workforce and staffing needs. We're also providing another $50 million for hospitals and nursing homes that will also help to expand the availability of COVID-19 testing, treatments, and vaccines. This emergency funding injection is to allow for an immediate ramp up in hospital and nursing home staffing resources. We will continue to constantly monitor this surge and take additional actions as needed. There are also things that the people of Maryland can do in the difficult weeks ahead. First, get tested. We know that many Marylanders have plans to travel to visit family and loved ones, or to host family gatherings and holiday parties. And you do so, it is important to use caution and common sense. If you're about to travel somewhere or you're just getting back, get a test. If you're feeling sick or you're coming down with something, stay home and get tested. With increased demand for testing, we're making 500,000 at-home rapid tests available across the state through local health departments. And we are aggressively working to increase those shipments and to get even more tests out more quickly. Effective immediately, we have expanded both the days and hours of operations at our Anne Arundel and Prince George's County state-run testing sites. And I have directed the Maryland Department of Health to surge all community testing resources across the state throughout the month of January. I am authorizing the mobilization of the Maryland National Guard to provide support personnel to help expand testing sites and hours. We have expanded the mission of the Vaccine Equity Task Force to offer community-based testing at clinics in vulnerable communities. And we will provide $30 million in additional funding for school systems to purchase more tests through state contracts. We're doing very high levels of testing right now, more than 50,000 per day, and we'll continue to do everything possible to further scale up testing operations. But there's only so much that the states can do. We also need the federal government to step up and do whatever it takes, including invoking the Defense Production Act to dramatically expand the availability of testing to the American people. Every American who wants a test should be able to get a test. In addition to getting tested, we still need those last remaining Marylanders to get vaccinated. Thanks to the millions of Marylanders who've rolled up their sleeves, Maryland continues to be one of the most vaccinated states in America. We have now administered over 10 million COVID-19 vaccines, and 91% of Maryland adults have gotten vaccinated. Our team will continue to work around the clock to get more shots into arms and to reach that last 9% of Maryland adults, because right now, that remaining 9% is responsible for more than 75% of our COVID-19 hospitalizations, pushing our hospital systems and our healthcare heroes to the brink. We're pleading with those people. Please do not wait until it's too late or until you get too sick. Go out now and get vaccinated. And if you've already been vaccinated, please get your booster shot immediately. I know that there's been confusing guidance from the federal government on this, but with what we know about these dangerous variants, nobody should think of a booster as just a bonus or an extra dose. And you shouldn't think that the term fully vaccinated means fully protected. If you've been waiting to get your booster shot, don't wait any longer. The time to do it is now. The latest surge is cause for concern, and so many of us are undoubtedly feeling deja vu. But I want to urge Marylanders not to panic. This is not March of 2020. We have the tools and resources in place to keep ourselves and our loved ones safe. We must remain vigilant, and we cannot let our guard down. Just as we have withstood these surges before, we will do so again by remaining Maryland strong. Have a safe and Merry Christmas and happy holidays. And at this time, I'm going to turn it over to Dr. Ted Delbridge, who's the Executive Director of the Maryland Institute for Emergency Medical Services Systems. He's going to provide an update on Maryland hospitals. Thank you.
Thank you, Governor Hogan. We have repeatedly described our fight against COVID-19 as a marathon. We knew it wasn't going to be a sprint and that there would be challenges. Actually, a friend of mine recently ran a regular marathon, and I was there to cheer her on. As it turned out, the course took the runners within eyesight of the finish line multiple times before they actually ran through it and celebrated their personal victories. My friend described the challenge of being so close to the finish line on more than one pass, yet so far from finishing the marathon. But with a lot of cheering and grit, she persevered. That's where we are and what we must do. As Governor Hogan described, we are at a new hill in our marathon to win against COVID-19. And as with every previous wave or surge, we face specific challenges. As of this morning, Maryland hospitals report that they are caring for 1,457 COVID-19 patients. The number of COVID-19 patients in our hospitals has doubled since the beginning of December. 19% or nearly 1 in 5 people in a Maryland hospital is there because of COVID-19. In the case of patients in an intensive care unit, 30%, or nearly 1 in 3, has COVID-19. Based on our experience with the previous 5 waves or surges of COVID-19 cases since March of 2020, we anticipate the number of people who require hospitalization to continue to increase and potentially exceed Maryland's peak of 1,952 last January. There are, however, 3 significant differences between now and the same time last year when we persevered. First, our healthcare system is different. Last year, it was poised to meet a surge of COVID-19 patients. Now, well into the marathon, some people have dropped out. While there is plenty of physical space within our hospitals, there is simply not the same number of staff members. During January of 2020, hospitals were able to muster enough clinical staff to keep 8,400 beds at the ready. In recent weeks, they've been unable to staff as many as 8,000, or 5% less. As hospitals are already occupied at 92% of their staff capacity, certain things are predictable. First and foremost, Marylanders can be certain that the healthcare system and the thousands of people who commit themselves to caring for others every day will continue to be there to do their world-class best. However, the necessity to care for more people with COVID-19 means that resources will not be as available to care for other, less urgent problems. Hospitals have already begun to curtail non-urgent surgeries and admissions, and others will do so in the days to come. Higher inpatient occupancy means less bed availability for patients who do require hospital admission. As of this morning, across Maryland, there are 314 patients in hospital emergency departments who are waiting for a room to become available. 3/4 of hospital emergency departments are currently alerting the state's emergency medical services system that they are at their capacities and should be avoided if at all possible. More than 50 EMS ambulances are at emergency departments waiting to transfer care responsibilities from EMTs and paramedics to hospital personnel. Second, another important difference between this year and last has to do with influenza. In the fall of 2020, we were concerned about what some people dubbed as a twindemic, COVID-19 and the flu hitting at the same time. In the end, we were fortunate. All the precautions folks took to protect themselves from COVID-19 also prevented influenza. The flu season was practically non-existent. That is not the case this year. Make no mistake, influenza is a serious burden to the healthcare system and kills people every year. Maryland is currently on a trajectory to have a flu season that will peak in January, much like years past. In recent weeks, we have seen the number of influenza-related hospitalizations multiply. While it is not on the scale of COVID-19, it is nevertheless significant. The time is now to get a flu shot if you haven't already. Third, we have tools. Vaccines remain our most effective tool for reducing the severity of COVID-19, both to us as individuals and to those around us. Hospitalizations, as Governor Hogan mentioned, are largely a result of being unvaccinated. While some vaccinated people do fall ill and some require hospitalization, they are the minority. 70% or more, depending on the hospital, of COVID-19 patients have never been vaccinated. I cannot emphasize enough this life-saving importance of vaccines. Among hospitalized people who have been vaccinated, most were vaccinated more than 6 months ago. There is strong evidence to indicate that we all need booster vaccines. For people whose vaccines were more than 6 months ago, the time is now to get a booster. And the time is only 2 months if your vaccine was Johnson & Johnson. People who become ill should speak with their healthcare providers about monoclonal antibodies to see if they are eligible. The window of opportunity is narrow and time is of the essence. Some rules haven't ever changed. The things we did last year made a difference. We need to do them again. Wash our hands and keep them away from our faces. And despite the nuisance of it all, wear a mask. It's just too easy and it provides meaningful protection, especially when we're around people we don't know and don't know if they've been vaccinated. And distancing ourselves remains in style. Finally, I'll reiterate that our healthcare system is resilient, but it is stressed, and it is likely to become even more stressed in the weeks to come. If we want our emergency departments to be ready to care for emergencies, we need to reserve them for that. We shouldn't forget about our primary care providers, urgent care and walk-in clinics, telehealth resources, and COVID-19 testing centers as important places we can get questions answered and much of the care we need. Now, I'd like to pass the baton to Dr. David Markosi, who's professor at the University of Maryland School of Medicine and the University of Maryland Medical System and UMB Incident Commander. Dave.
Thank you, Dr. Delbridge. Good afternoon. Marylanders, Governor, thank you for your steadfast leadership and the opportunity to speak again on this crisis. I wish you a very speedy recovery. Fellow Marylanders, this week, the University of Maryland Medical System will surpass the highest number of admitted COVID patients since the start of this pandemic. In the 20 years of practicing emergency medicine within the military and as a civilian, these are some of the most challenging times I have ever seen in healthcare, with many hospitals at or near capacity. What does this mean? It means exceedingly long waits in emergency departments. It means potential delays in surgery. It means limited availability to see your primary care doctor. This isn't just a COVID problem anymore. COVID-19 is limiting the ability to care for many other illnesses and surgical problems too. Why are we having an increase in COVID cases? Why are hospitals near capacity? Dr. Delbridge mentioned a few, and I'll make sure that I emphasize a few others. For some, they are still not fully vaccinated. Without question, this is the main reason for continued increases in COVID hospitalizations. I want to be very clear on this. Hospitalizations from COVID are largely now a preventable problem if you get fully vaccinated, which means getting a booster. Another reason for this increase in cases is that we have become too relaxed with our protective measures. From businesses to churches, we need to reinstitute preventive measures, and we need to do so today. This includes mask wearing, ensuring adequate ventilation for high-risk areas, staying home when you're sick, and testing if you've been exposed or have symptoms. Layering these strategies together is incredibly helpful and effective in preventing the transmission of this virus. Regrettably, hospitals are near or at capacity because there are far fewer staff, as many have left healthcare due to frustration or exhaustion. We all owe a debt of gratitude to those who have persevered and stayed bedside. But the bottom line is that fewer doctors, nurses, pharmacists, and therapists means less access to the care we all need. With my final minute, I want to provide some clarity on a few confusing issues. Number one, on infection after vaccination. These vaccines were designed to save lives, not stop infection or completely block transmission. They are doing exactly what they should do. You can still test positive for COVID even if you are vaccinated, which is why testing and mask wearing are still needed. On masks. Masks work to decrease the spread of all virus, including flu and COVID. They are cheap, easy, and effective ways to keep you healthy. We should all use at least well-fitting surgical grade masks inside public places. Although I don't like it either, we need to wear the damn mask. On science. Scientists and doctors are learning more every day about COVID. As we do, guidance may change. That is a good thing. It is like any other medical discovery. Doctors change treatments based on new research, just as we do for cancer care. That said, Facebook and social media may be fun, but they are not reliable locations for validating worthwhile advances in science or medicine. Finally, this holiday season, let's assure we connect with friends and family. If one thing this crisis has taught me, don't take anyone for granted. Please reach out. Don't get too busy. Our state has led our nation through this pandemic, and it is time to unify and do it again. We know what to do. Now we need to do it. I wish you all a very happy holiday and very Merry Christmas. I will now be followed by Deputy Secretary Dr. Jinlene Chen.
Thank you, Dr. Markosi and Governor. Good afternoon to all Marylanders. I would like to briefly talk about the Omicron variant and what we know about it so far here in Maryland. As we've said before, the virus that causes COVID-19 illness has been mutating since the pandemic first started. Most of the mutations have not changed the way that the virus behaves, but more recently, just this past year, we have seen changes that makes the virus spread more easily from person to person, including with the Alpha variant this last spring, the Delta variant this summer and fall, and now the Omicron variant. The CDC just reported yesterday that nationally, the Omicron variant now comprises about 73% of all cases sequenced in the United States. In this region, which includes Maryland and Washington, D.C., the CDC estimates that 75% of cases are the Omicron variant now. Here in Maryland, we actually detected our very first Omicron variant cases on December 3rd. It is now much more prevalent, and the preliminary information from our sequencing labs in the state show that Omicron comprises nearly 40% of the sequence cases at this time, with the numbers increasing very quickly. What we know of the Omicron variant so far is that it can be spread even more easily than the Delta variant, as shown by how quickly it has increased in both the United States and here in Maryland over just the past 2 weeks. In terms of vaccine efficacy, while we do continue to learn more about this new variant and its impact on vaccines and other treatments, these vaccines, especially with a booster dose, appear to be effective in preventing severe illness and hospitalizations, which is our primary goal. So as the governor has indicated, vaccines continue to be one of our most important tools against Omicron. In addition to getting vaccinated and a booster shot, testing continues to be a critical part of keeping you and your family as safe as possible, including if you have any symptoms and before and after any travel. I also want to stress the importance of getting our children tested to stop the spread of COVID-19 variants and for them to return to school safely after the holidays and to keep them in the classroom. Our K-12 screening testing program across the state has made it very convenient for parents. You just need to consent for your child to take part, and I encourage you to talk to your school's principal to see if your school is taking part in the state's testing programs. Last, as I know many people have travel plans in the coming weeks to connect with family and friends, like Dr. Delbridge and Dr. Markosi have mentioned. I also strongly urge you to continue to practice other layered precautions in addition to vaccinations and testing, including masking while indoors and avoiding large gatherings as much as possible. I want to thank you all for joining us today and everything that you're doing to protect yourself and your loved ones. I wish you and your families a happy and healthy holiday season and new year.